Welcome to the PhysioFlow software demonstration video. If you're connected properly, you will see this screen that shows your device has been detected. In this particular case, we're using an Enduro unit. It shows that our battery power is okay, device is fully connected, and that we're able to start measuring. You have two options. You can do real-time monitoring, or you can do monitoring using a cardiac output Holter if the patient is exercising. In this particular case, our patient is at rest, so we'll go to real-time monitoring. Next screen is creating a new patient, or if you've had a previous visit, reload that patient so you can compare results. In this particular case, we will create a new patient. You can add in a patient ID, maybe it's a number, maybe it's some symbol sequence that makes finding patients easier in your practice, but that is completely optional. Next, we'll go to date of birth. This can be typed in or found in the drop-down. That automatically calculates the age. We'll say that he's 6 feet 5 inches. Again, you can go down or you can go up using the arrow. We can put in the weight and we can check male. Once you see all the green arrows, that means you've accurately entered the information and you can proceed. The next thing we need to do is set up how we want to complete our profile. Do we want to look at time or heart cycles? How fast or how often are we measuring a signal? In this case, we're going to use time, and it's going to make a reading every 10 seconds, which is the default. You can make that more frequent or less frequent depending on what you want to see. It's very important to denote if the patient is at rest or exercising. Again, our patient is at rest today. And then the number of cycles for the calibration, we default at 30 cycles. This can be increased or decreased using the arrows, but again, our default is 30 cycles. Once we have green arrows, we can proceed. This screen just reminds you proper preparation of the patient. It reminds you to shave the area required for the electrodes, to clean the skin with an alcohol prep pad, and to rub the skin with some new prep abrasive gel. And when you see some slightly pink skin, that means that the area has been properly cleaned and prepped and you're ready to go. Click OK. Now the software is looking for the patient. It takes a few moments for the patient to be seen. On the left side, you will see initially a red bar, which turns to yellow, which turns to green, meaning you have full green bars, means full signal quality, and then you're ready to calibrate. So we'll give this a moment to do so. And there we have it. Full green bars on the left means we can proceed to calibration. Here you see number of calibration cycles out of 30. Had you changed that, obviously that number would change from 30 to whatever you put in. But now we're calibrating 15 out of 30, etc. The next question it's going to ask is to have you put in the blood pressure. So we'll put in 135 over 79, and we'll click OK. And you get your calibration results. Being a Windows-based software, you can maneuver this. We can push that over to the side. We can stretch this out to make sure we have visibility to all the different parameters. Pretty good profile. Heart rate's a little bit elevated, perhaps because of the video, but everything else looks pretty good at this point. There's a couple different things you can do. You can do a table view. It's a little bit easier to read, perhaps. Or you can simply go back to the calibration home screen. At this point, you could end the test if it's just a quick screen, if you will. But what most people use the Enduro and the Q-Link for is to go to real-time monitoring and get a better battery of test results. So we'll go there now. As you can see, we're measuring 4 primary metrics, if you will, but by going over to the display, you can add in a variety of other parameters depending on what you want to measure. So being a Windows-based software, this gives you lots of flexibility, and we'll wait for these measurements to start to calibrate, and you get a full cockpit chart of different things. So if you go up to the Analysis tab while this is generating some data, you can generate a full report, which sends a report over to a PDF file that can be filed into a patient's folder. The compact report has a truncated view of just those 4 basic parameters: stroke volume, cardiac output, cardiac index, and heart rate. The full report is going to give you results for any of these different parameters, so it's going to be a little bit longer report. You can go to a Hemodynamic Cross, which shows how the patient is doing in terms of, you want to be certainly in that green box. If you're just simply a numbers person, you can go to a comma-separated version file or an Excel file, and that's just going to spit out raw data. So now that these have come up, we can continue to have this come up, but for the interest of time, we're going to stop measuring. And then it will give you a summary of your averages. For instance, on the stroke volume, 88. Stroke volume, typically you want between 60 and 100. Heart rate between 60 and 100. We see this is 90. So again, you'll get a summary of how the data was read, and then you can export that as well. So at this point, we'll close the measurement, and thank you for listening to the software overview video.